David, it seems a great irony to me that in the midst of the opioid epidemic, that one of the solutions is to use antidepressants now for pain, which had its own overprescribing problem. So what's the reason, what's the rationale for it, and are antidepressants really a different option or a better option for certain types of pain?
Well, that's a really good question. We all know that the opioid epidemic is reaching colossal proportion in the United States, and that people are looking for what they call a multimodal approach to pain relief, especially after surgery. Now, traditionally, it used to be that the surgeon would prescribe almost all the pain medication for the surgical patient. We're talking about surgical patients now. And they would get opioids. And that's how a lot of people became addicted to things like Vicodin and Percocet and oxycodone and other opioid medications. So instead of getting a whole generation of people hooked on these medicines or dependent on these medicines or subject to the side effect profiles of these medicines, their multimodal approach included different agents. Some of them would be local anesthetics injected after surgery. Some of them would be anti-inflammatory drugs. Some would be of the class that you mentioned, which are either antidepressants or anti-seizure drugs like Lyrica and gabapentin. So they found by using this multimodal approach of using a combination of medicines instead of just opiates, that the side effect profile of nausea, vomiting, urinary retention, constipation, and itching, let alone respiratory depression, went way down.
Yeah, but those are the least of the dangerous things. I mean, in terms of side effects of opioids.
Right.
I mean, the danger of opioids is really the addictive nature.
Right. So we talk about two dangers of opioids, the acute dangers that I mentioned,
right,
most of which really you worry about respiratory oppression. People have died in hospitals because no one's checking their respirations and they got too many opioids in addition to their other medications that they're taking. So that's the short-term problem. The long-term problem is exactly what you said. It's been estimated that 1 in 10 post-surgical patients have a propensity to become opioid dependent even after their surgical pain is gone. So what the scientists have found by using these drugs like Lyrica and gabapentin in smaller doses, it's kind of reset the brain and the nervous system in the perception of pain. And it's even been shown that 6 months down the road after a surgery, if you were to take a drug like Lyrica or gabapentin, the pain problems that can come down the road would be lessened quite a bit.
So Lyrica is lowering basically the amount of other pain medication.
Right, it's what they call opioid sparing.
Got it, okay.
Right.
And is Lyrica used for short term, or do they then become ongoing Lyrica users?
No, it's usually used short term.
And mostly for post-surgery?
Yes.
Any other places that they're using antidepressants?
Yes, they're using them in neuropathic pain, say in shingles. They use it also for people with diabetic pain, like diabetic neuropathy. They use it for pain syndromes, which are called complex regional pain syndromes, which are pain after an injury, say you break your arm or you have a laceration, and then some people have a propensity to get pain out of proportion to the injury that lasts months or even years. So some of these other medicines play a role in reducing pain for those people.
Okay, so this is something that somebody should ask their doctors. If they're being given a prescription, should they also potentially be given a prescription for the antidepressant?
Right,
okay,
exactly.
Great.
Yes.
All right, thank you, David.
Okay.
If you like what you just saw, do me a favor, share it. The healthcare challenge is really a problem for all of us. And the more we can get this information out and get people taking better care of their health, the healthier we will all be. We have more videos with Dr. Scherer as well as his blog, What Your Doctor Isn't Telling You, at our website, bottomlineinc.com.